Hi, my name is Dr. Melissa Lopez. I'm a pediatric dentist, and I am here with Dr. Alena Larios and Dr. Claire Ferrari of Ferrari Larios Orthodontics. And oftentimes what we get questions of when kids come into my office is, what are you looking for? When do my kids need to go in for braces? And one of the things that we're changing is we're evaluating airway health, growth and development to see when exactly is the right time for these kiddos to start seeing an orthodontist. So we're here to talk a little bit about that.
Yeah, and I'm just so grateful that you think about that and look at that, because that is the basic reason for orthodontics even existing as a profession. It's the lack of growth of the bones of the skull that lead to the lack of bone for the teeth to fit. So when the teeth don't fit, that's why people are like, I need to see an orthodontist.
And most people don't think about that.
Right.
They just see crooked teeth,
That's
think
right.
straightened teeth, right?
Right.
Mm-hmm.
And then it was also super common to like take teeth out to make them fit. So we are much more about creating the underlying bone structure so the teeth can fit.
So when we think about the why, like where does that coming from? That's where the skull comes in.
Yeah.
And we are looking at how the roof of the mouth is the floor of the nose. And when the roof of the mouth isn't wide enough to fit the teeth, and the result is crowding, and that's what we see, you know, when you're just looking in the mouth. But when you look at CBCTs, at 3D imaging, then you can see, oh, there's crowding, and I see restricted nasal volume. And oh, you answered that you snore at night, or your child snores at night, or is wetting the bed. Those questions then lead to more questions, and the imaging supports that, and then that's when the clinical findings come in. So it's really about looking, for us, starting with the health history form and asking the right questions, not only in the initial exam, but throughout treatment, to make sure that what we're doing is addressing the right cause, the why. Using the CBCT machine to support that, and then the clinical findings and conversation with families. So
Yeah, and it's so much fun because there are so many layers to how this all plays together.
Well, we think it's fun.
Good point. What's fun about it is that it's like, oh, it's why orthodontics is a thing to straighten the teeth, but to see the underlying need that's actually there, and
Right.
that they are looking better, but they're also feeling better, and it's answering so many questions.
So true. So true. And sometimes people say, well, as a pediatric dentist, where do you come in with all of this? And for us, it's looking at exactly what you're saying, pediatric sleep questionnaires. Those are easily found online. So for any parents that are out there that are wondering whether their children fit this, they're looking for the signs and symptoms. And those children might need intervention earlier than what we now consider traditional orthodontics, right? Which will sometimes start around 7, 8, 9 with a phase 1.
Right. So, for us, that PSQ is essential. That's when people ask, like, well, how early do you get in? I'm like, depends on what the sleep questionnaire answers are. And we'll get in as early as 3, which is not normal in the orthodontic world. It is for the orthodontists who focus on airway.
Right.
But it's not normal in the general orthodontic world. But for us, it's like the amount of brain development that's happening between 3 and 7 is enormous.
Yes, talk a little bit about that.
So when we have a child come in with a health history form that says they're very kinetic when they sleep, they're wetting the bed a lot, they're wetting the bed, and they snore or their mouth is open. There are many questions on the health questionnaire, but not too many that it's overwhelming. There are a lot of yes answers, even a few. We're like, oh, let's take a look. And if they have a restriction in the development of usually it's the maxilla, because the mandible, the mandibular body here is very genetically determined, this part. Then the part that holds the teeth is determined by what's happening up here. And this part is very epigenetic, meaning there's so many environmental influences on the growth of the top jaw. By the time they're 3, a lot of that has already started and is happening. So there's a restriction in this development. That's what leads to not enough bone for the permanent teeth to fit in. And then they're on that trajectory to not enough room for their teeth, but then as Ali was saying, not enough room for breathing through their nose, not enough room for their tongue to be up in their mouth. Then they're on this cascade of the tongue is not up in the mouth, it's low. The tongue is one of the drivers of the growth of the maxilla. So then you get in this negative feedback loop. Then the nose isn't wide enough for easy breathing. And then they have less growth because the tongue's not up there. They're breathing through their mouth. They're not creating nitric oxide. The tonsils are filtering the air. The adenoids are filtering the air. They're getting bigger, making it harder to breathe through the nose.
Right.
So it's just a cycle. Sorry.
And then the brain development piece.
Huge.
That's where we are.
Huge.
There's people now, they are doing brain mapping.
Yeah.
I don't know all the details of this because I am not the person doing the brain mapping, but we have been engaging with them and actually seeing the results of little ones that have gone through expansion. They do the brain mapping prior to expansion, then after expansion, and they show, you see the graphs change after they have gone through an expansion, and that's through, they're just breathing better.
Yeah.
So again, that research I think is still to come in a way that's like published, but it exists, the data exists. So, and again, those are the things that we see chairside, right? Those getting the feedback from families and asking those same questions. Are they still snoring? Do you see them wetting the bed? And commonly, within a couple of months, those answers start to turn to no's. Mm-hmm. And if they don't, then that's when we need to look a little further at tonsils, adenoid, other things that we as orthodontists may not be able to address directly, but we can at least find the right people.
Right. It's a complex system, and we're dealing with the structural part of it, and then there's the behavioral part too. So then they have to use the structure we're helping create to keep their mouth closed, breathe through their nose.
Breathe through their nose.
Yeah, we're making the nose a superhero.
That is true. I'm trying to create a t-shirt right now with the nose looking like a superhero.
And that is what we're doing too. You gotta retrain the nose.
Yeah.
I often say to kids, your nose is not just for smelling cookies.
That's a good one.
You're supposed to breathe through it too.
Mm-hmm.
They forget.
Should print that and put that on the wall. Quotes from Melissa Lopez.
That's the one quote I'm gonna get out of it. Hilarious.
Love it. You guys are great. Okay, perfect. We hit 5. Let's talk about how do pediatric dentists and orthodontists work together to make sure that it develops in a way that it's supposed to.
Do you think we already talked about that a little bit?
Kind of in that.
Just to have it in its own little category.
How do you want us to start talking about that?
Just jump into it.
Okay. So I know at our practice, what we started implementing a few years ago when this came into the pediatric dental research, because you know that sleep medicine has not been around for a very long time, and it always starts in adults. And as we start looking for upstream causes of obstructive sleep apnea, we've started to recognize some of the signs and symptoms that we're able to see in the pediatric population. So in our office, we always do screenings, not just the questionnaire that we mentioned earlier, but we also, when we're doing our exams, we're looking at soft tissue, we're looking at growth and development, we're looking at nasal breathing. So when we send patients out for referrals after we get positive signs and symptoms, let's talk a little bit about what that would look like for a patient coming from our office and coming in to see you guys. What could they expect out of us working together like this?
Well, then we would do the imaging that Dr. Larios was talking about, like looking at things on a low dose CBCT. We can really see what's going on with the inside the nose.
And that gives 3D views of everything,
3D
right?
views,
So looking at the skull and seeing all the spaces.
Yeah, because we are 3D humans, and being able to see things three-dimensionally is absolutely game-changing. Like, you can't do good airway focused work unless you have a CBCT.
Correct.
So
Also,
that's
I'm sorry, go
game-changing. No, you go on.
I was gonna say, you also can't do good airway focused work if you don't have that team, because it's real. And
It's a team sport.
Yeah, we're constantly saying this, and it's so true that when, yes, they're going to be walking through our door, and we would be doing the orthodontics, and we're going to be in their lives. Let's say if they're starting at age 3, 4, 5, we're going to be around for a bit because we are still monitoring that growth and development. But to have a pediatric dentist who is also looking at that, and maybe even seeing them more often when they're in that now observation phase, if they're between phases. And having that dialogue of, oh, I'm seeing these positive changes, or I'm not seeing these positive changes that I expect.
Yeah.
Let's talk about that and figure out how we can get that little one to change their trajectory, and who else then becomes involved? Is that myofunctional therapist? Is that the ENT? So I think the more people that are on the team for a child, the higher that they're going to have the higher chance they're going to have a positive outcome. I feel. Yeah. So that's why it's important, and it's us sharing, those images with you and photo, all the things that we get, and we get a lot of records. So
all the communication.
All the communication. Yeah. A lot of it is like, yes, we see patients all day, but constantly going back to the computer and like emailing with other providers, right, to communicate about our patients. So that's where it becomes, I feel, it's next level at that
Team
point.
sport.
Yeah.
It is.
What would you say makes each of your practices special or unique in this space? Like, why go to you guys?
We're the only ones doing it.
I know, that, for me, that's like, oh my God. It's just sad, right? That is not the norm yet. The joke that I was, no, it's not a joke, but it's true, that I was telling Dr. Lopez when she came in, I was like, I used to say, in 10 years, this will be the norm. And it was 10 years ago. And now I say, in 20 years, it'll be the norm, but it is happening. It is happening. They're talking about it at the
It is happening, and there's plenty of research out there showing that it takes 20 years for research to make it into clinical practice.
Yeah.
So I feel the part that makes our practices, both individually and collectively, unique is that we're doing this now. We're staying abreast of the research that's coming in. We're constantly changing. I mean, I don't know about you, but what we're giving patients and the information is constantly evolving. It's an organic product that we make, and the more that we learn, I think the more that we incorporate that. And so we are being able to help a bigger percentage of people in the early stages of this field.
Yeah.
And being a part of others that may not be, again, in the East Bay, but those people who are driving the research and engaging with those people directly, doing a lot of continuing education, like a lot of continuing education.
We like learning, right?
Yeah. So constantly, but both in the Airway, those conferences that are centered around what we're talking about, but also going to continuing education where it's not so much, and kind of understand, like being aware of both, all the perspectives. And that I think also makes us a little unique in that we know how others view things, and we know how we view things, and therefore when patients come in wondering, why are you different, like asking this question, why did the other orthodontist say I don't need expansion? We can say with confidence about what we think and why, once we have that understanding of all sides.
Yeah, what it feels like comes with all that is like we know how we see things, the eyes we see through, and it feels like the underpinning of so much of the health issues that kids face, like the whole idea of automatically going on meds for ADHD instead of having a sleep study done. And then these sleep studies can be so heartbreaking, right? Because they're not actually done in a way that really is eliciting what's true for the child,
Or even the information that you get.
Right.
I hear parents come back and say, oh, it's just mild.
Yeah.
And for me, that breaks my heart, because any child stopping breathing at any level is not mild.
Not okay. And even if they are under the radar of sleep apnea, but they're doing a lot of having a lot of hypopnea, it's like, that's not good.
Right.
And so it's like someone at the meeting, we were just out last week and said, it's like saying you have mild cancer.
Correct.
This is like, no, mild is not the right word. It drives me crazy.
Right.
But the other piece is like, we also really have a good sense of what we don't know, right? And
true.
that, like, the interdisciplinary piece, and really being curious about like the skull and how it's articulating with the spine, and how it affects posture and movement, and how all this health piece, it's deep.
Because it becomes whole body,
Yeah,
right?
it does,
It's
yeah.
whole body, and again, our training is in a certain area, but that is all connected, as we know.
Yeah.
And so when it becomes whole body, that's when we then go back to the whole team approach. We have to talk to, things, so many things we don't know.
Yeah.
So does the physical therapist that might be,
PTs, osteopaths,
all of those,
Right.
all of those people. So it's harder, right? The way we practice is harder. but it is so much more fulfilling, and that's why we keep just digging in deeper and continuing to ask more questions.
When you get the parents that come in and say, why are you the first person that has said all of this?
Yes.
Everybody has been telling me that I don't know what I'm talking about.
Exactly.
I'm seeing things incorrectly. I've been looking for answers, and you're the first person that's connecting it all. It does fill you with a sense of, okay, great, this
It's
is
worth
why
the time and energy.
I'm putting all of this in. Yeah, one of the areas that in our office that we've seen that come in, because we do focus a lot on behavior management, is in looking at nervous systems and how regulated or dysregulated they are. And thankfully, we started incorporating ND-YAG laser therapy to help with re-regulating and to help with turning on parasympathetic nervous systems, helping kids who are on the sensory spectrum. Maybe I'll cancel that part of the question.
I'll write that down. Say it however you want.
So we are using ND-YAG laser therapy to help with kids who are exhibiting dysregulated nervous systems get back on a re-regulated path for their growth and development. And approaching it from that aspect incorporates a new part into pediatric dentistry that's not even considered traditionally what we learn in dental school or in residency.
The word nervous system never came up in residency or dental, so I can tell you that.
Right.
But it is what we see in a lot of our patients, that they need some kind of regulation. Can you talk a little bit more about the ND-YAG? Is that it?
Yeah, so you know lasers, when you
Yes.
say lasers, there's all sorts of different lasers, and they all depend on what type of medium the light gets put through. So there's a neodymium crystal, and it exists in so many different places right now. Everyone talks about red light therapy, you know, red light saunas. You can even buy some online to use at home. The one that we use is a medical grade laser, so it's in the 1064 nanometer wavelength, and it penetrates deeper. And there is a sequence along which we use it, the vagus nerve and the cranial nerves of the head and neck. And it helps for a lot of different things, but one of the main ones that we use it in kids who have sensory issues is to help that parasympathetic nervous system kind of kick on. Because when you're stuck in that sympathetic fight or flight and you don't know how, your body doesn't recognize how to get out of that. And part of that is a lot of mouth breathing, right? And it becomes a chicken and the egg question for us, which one started first, and it almost doesn't matter.
That's right.
How can we help them, right? If we find that there are craniofacial deficiencies, getting them to you for expansion, that will oftentimes help with behavior. But in addition, if we give them the support of the light therapy, where we're feeding the cells this light energy that the mitochondria can absorb, and in turn boost the cell production, get nervous system growth, get those muscles glide along each other better, release the fascia, which is a huge one. And at a certain end, and this is where our CE comes in, that starts to get kind of outside of what we were trained to do, but is on the periphery, is we're seeing a lot of brain health, looking at where trauma is stored and noticing that trauma is stored in the myofascial system. And so releasing that myofascial system allows for release of some of those traumas, as well as releasing the muscles so that they function better.
And how many, is it variable how many sessions are required, like on the vagus nerve, on the cranial nerves, to see?
Everybody's different, and it tends to work faster for the younger patients. So when we do what we call baby lace on infants, it can take a couple of sessions. What I found works best for me is by the third session, I'm usually seeing maximum effects. And that's generally because people are now used to it, they're used to the feelings, they're used to what it feels like. And it's kind of like if you got a really deep tissue massage, but with light. And one 8-year-old described it like, oh, it feels like you're giving me a warm bath, but instead of using water, you're using light. And
How long do the
it's
sessions
beautiful.
last?
For kids, about 15-20 minutes. For adults, about 30 or so. Not very
That's
long.
good to know.
Yeah.
Is it with the Photona? Which
It is with the Photona Lightwalker, so using that that technology.
And you have to go to different CE courses to learn how to use the laser for that particular modality, or
Oh, for sure.
Yeah.
Yeah. I mean, we use the laser for hard
You're
tissue.
doing
We
night
can do
lays,
so many
you're doing-
different things with that laser in
Right,
particular
right.
because it also has an erbium YAG crystal in it.
Mhm.
And that's what we use for surgical procedures like soft tissue releases. We use it for restorative dentistry, but specifically, and my big love is this neodymium laser, and the beauty of what you can see and how you see people kind of take that deep breath that
Yeah.
everyone talks about when you can finally feel your body relaxing.
Yeah, it's like that whole chicken and egg thing, right? That is, it's so intertwined, right? Then you said it almost doesn't matter because it's like it's almost impossible to tease it all out because they keep feeding back on each other. But it's the idea of, you can structurally improve them, but if their nervous system isn't ready to shift into that benefit,
Correct.
you need to calm
Exactly.
things down.
Yeah,
That's so interesting.
isn't it? I know.
Because if you don't get that under control, what we're doing may not matter, right?
Yeah.
Or you see a lot of relapse.
Yeah.
Mhm.
Yeah.
Because if your muscles can't support the structure that you're in, you're
Yeah.
going to relapse. Right?
Well, if everyone could get some kind of craniosacral therapy, something like that. I mean, this is why I asked, like, tell me more about this, because if everyone could get that while they're going through expansion or treatment, it would be amazing. But that's just reality.
It's like,
it's
what
really
are the
hard
limitations for the family, and what do we guide them toward? This is actually very important.
And that's why our practices are so unique, because we are taking all that technology, the CBCT, the lasers, all the technology, bringing it together and working together to get optimal results.
How do you monitor nasal function? Do you do the rhinometry, or what do you do? You ask questions.
Can I just have you tuck your hair a little bit from the back?
Yes.
How do you evaluate? Is it
yeah, but I have to.
what?
I said not yet.
Okay.
But actually, this morning I was talking about how I need to start doing that more.
Oh my God,
That'll be part 2.
No,
We're back in 6
there's
months.
so many things.
It's getting hot now. It just made me start sweating, Claire.
Well, this is where we're literally like, that space, this is not for the camera, that space next door is like, oh my God, do we need to like break into that? Because like to fit all these other little things, the myofascial
I'm trying to build out an
therapy.
office right now.
Oh yeah.
Are you?
Well, yes, I'm trying to move the space so we're out of the shared situation.
Great.
Yeah. For all of this, to create more space to
Right,
do
have a
this.
center.
Exactly. Yeah. This morning we just got the newspaper approval for the change of DBA to
Oh,
incorporate
great.
the ABC, the air breathing center part
Oh,
to the name. So
Wow.
now it's
ABC.
Shadelands Pediatric
Oh, that's such
Dentistry.
a great-
ABC.
That's gonna be a great logo of some kind.
That's really
yeah,
good.
With,
Yeah.
Yeah, with the kid.
Yeah.
That's
Yay.
great. Yeah, I know. Thank you. All right. Next
Can
question.
we just end? I think you guys hit all the questions.
Okay.
Any kind of sort of just invitation, any last things you want parents to know, just like a direct call out to the people listening.
Well, the thing that I was going to say is what you were talking about, like the meeting that happened in 2019 in the orthodontic community, how it was just like kind of heartbreaking because Christian Guilleminault was the father of sleep medicine.
Down at Stanford.
Yeah, and how and brilliant mind, and then how he was received was just kind of, it was so heartbreaking to me. But this whole thing around it takes 20 years. It's being driven by the parents.
It is. Because who knows their children best? And I often say this to parents when they come in. I say, I can see and I can give you all the information, but I need you to go home and be the detective. I need you to go in and monitor how they're sleeping. And that doesn't mean just opening the door and looking in. It means walking up to them and looking at this list of signs and symptoms and telling us, are they doing any of these on a consistent basis when they're not sick?
Mm-hmm.
If you're sick, and then how often are they getting sick?
And how often?
Right.
That's true. I should add that question.
Yeah. Just that, even for me, when I started to get into this airway world, hearing that you should not be getting sick more than once or twice a year, I was like, really? Like, it didn't occur to me that there's like a norm or something beyond which something's up.
Right.
That should be addressed.
Yeah. I was gonna say in terms of like just something to say to parents, or what I would think is that there are some people, like you said, that some parents are like, I know there's something going on with my child, and you're the first person who said something, or sometimes for us, it is, I get excited about someone, I'm like, I get to talk about these things that we've been talking about and educate a little bit, because people typically do find it so fascinating once they start learning about it. And so I suppose it's a matter of, encouraging families that when they're like, that's not right, finding the right providers, because it can be hard to find the right providers, but that's why we continue to try to do little CE things, even our community lunch and learns, just educating others, even when people say, what are you talking about, the white paper, right? It's like, well,
the more you get into it's so defensible, right? Because it's just reality, and the parents really do start going, like, even if that they came in for a little crowding here, then we ask the questions, and it's like, oh, even if they said, this is what's interesting too. Sometimes there's like this no on a lot of the health history questionnaires, and it's because the parents are late for the appointment and they just want to fill it out, and they're like, no, everything's fine. I just want to deal with the underbite or the overbite or the crowding. And then we're talking about these things on their child's image on the screen, and the child will say, wait, you mean I might be able to breathe better through my nose when I'm playing basketball or run? Like, they understand that
is true. I have had a few kids say things that the parents don't even know about.
Right.
And sometimes had parents look and say, why didn't you tell me that?
Right.
Because the kid, if this is how they've been breathing, this is what they know is their norm. And a lot of the research shows that this craniofacial development starts between 4 to 6 weeks in utero.
Right, exactly.
Right? When you're getting that dural growth and all of that. So tongue development, muscle development, all of that starts really early on.
Really early. And the other piece is, like, we treat all these adults, and we're like, we want to treat more of the kids. But we see these adults, and it's like, oh, you poor thing, like, this started so early. And they know it did. They're like, this has been going on my whole life, right? And then there they are with 4 fewer permanent teeth, and, like, lots of dental work that's breaking down, and, God knows what health issues they're facing. But it's like, oh, if we could have just seen you early. It's like we have these child versions of these adults we're seeing, and it's like, this
and
is
that's where
we're
pediatric
heading.
dentists come in, right? Or we can come in.
Absolutely. Yeah.
Awesome. Do you want to just do a sign off? Thank you.
Well, thank you so much for sitting down with me for this. I think we're all really passionate about it, and we can probably talk for hours. Lots of tangents to go with, right? So maybe there'll be a part 2 someday.
Okay,
Let's
let's
do
do
more
it.
stuff.
Thank you, Melissa.
Thank you.